So, good morning, my lovely fellow prevention specialists to be. Um, I hope everyone is doing well, staying warm. It's 17, just outside of Cincinnati. So, if you end up watching this in June, you can remember the weekend before the big storm. Um, any questions on anything? Right. I will tell you that let me open it up here. Mhm. We had three people play Kahoot, and um, Miss Amy Johnson, you you won. Yay!
That's my
What kind of
competitive side coming
I
out.
know, I hear you. I hear you. So, what kind of prevention do you do? Do you like
I
going to schools or
I'm the supervisor for Talbot House Prevention
okay,
in Warren and Clinton. So
okay.
um, I'm the new BAM, as I call it, Barbara.
I gotcha.
Barbara's
Yeah, yeah,
still
yeah.
there as our consultant, but
Right. All right. I will supply you with a small gift for winning. Um there
oh,
will
thank
be
you.
a there'll be another one coming, another Kahoot coming this week. Probably probably give you a couple things to do with the potential of no school on Monday. The other thing I wanted to show you guys, let's see, let's put this over here. And I will give you the link to it, but let me hang on. Let me get to um nope, that's not what I wanted to share. So I have taken on Amazon, I've created an exam prep list. Um, I told you guys that there were some resources on this is the resources we use to make this exam list, that we couldn't find online, like the alcohol no ordinary commodity, critical incidents, um, focus on prevention. So these are the documents that you can't find for free online. So if you want to look at any of these, I don't make money if you buy it off the list or anything. It's just a list for you to if you want anything on here. It's not, I'm not going to say that, it's cheap because some of them can get up there. Um, some of them you have to like buy from a private person, um, which always cracks me up that some of these are old and they're using them to make our exams. Anyways, um, the other thing, the one that I was working on this morning, putting some more things on here, is I have a just a general prevention resources. This really doesn't have anything to do with the exam. Um, but it's like this book, when I first started in prevention, was my Bible. 104 activities that build. This has games and like fun things to do that then have a purpose behind them. This buzzed book, I don't even know um, what issue we're on now. Um, it's basically a book about all drugs. It goes from alcohol to Xanax, and it just gives facts. So it's a nice resource to have. There's some games on here. So it's not, again, not like, recommended by anyone in particular besides me. Um, but just some things I found in case anybody is interested in any of that. Any questions on any of that? All right. One more thing I'm going to show you. Oops, hang on. You are welcome. Um, one more thing I want to show you, and I may have mentioned this, but I usually wait. Um, there it is. Anybody ever used Cram? So Cram, like you're cramming for a test, is an online flashcard site. And what I have done is I've gone in and taken all of the CADCA primers and put the glossaries in here. So if you search CADCA, and yes, there's an app for this too, you will see the different um, glossaries. Good, good. I'm glad, August. Um, Plus, you also, if you searched prevention, you'll see some people have put in some things. I get a little overwhelmed in my brain when I see 276. But if you like a bunch, then great, go for it. Um, but what you can do, you go into um, into each one of the like sets of cards, they call it, is you can just do basic flashcards. So it gives you the definition and you turn it over and it tells you the what it is. And you can go back and forth with that one. And then you can go to the next one and it tells you what it is. That's great if you want to do that. Um, they also have where you can take that list and make a test for yourself out of it. So if you're like, you know what, the evaluation primer, I really don't know much about evaluation. So I'm going to make myself a list. You can do matchings, you can do multiple choice, you can do true or false. So let's do some multiple choice and true or false, and it will create a little test from that glossary. Again, yeah, everyone likes different things. There's also a game section. Now, there's only two games, and this stellar speller is not something we would ever worry about unless you want to learn how to spell evaluation or qualitative and quantitative. But this one is kind of dorky and fun. Um, so it's got the words over here from the flashcards, and it's got the definitions. And so let's see. I'm just going to pick one and say, oh, nope, that was wrong. So it locks it off for a while for you. There is an app that you can, like, if you're sitting at the doctor's office waiting or you're waiting for your next group or something, that you can play. Um, but you can also search like prevention and it will show you other people have put in things. Um, I think I also put in the CPS test. Yeah. And people have put in different ones. Play around with it if that's something you like. I just like to give you different kinds of ways to do things because everyone's a different learner. So Cram is your other resource that I like to give you. Um, of course, the Cahoots are fun. I've got some more Cahoots that we'll play. Any other resources anybody's found? August likes the self-paced, healthy knowledge learnings. Um, I always start with free stuff, so you know, try things that are free first, and then if we got to pay for it, we can do that. But um, all right, let's get started today. You should have read the community assessment primer and the capacity primer. So if you remember our little spiff here, we always start with the assessing needs or assessment. So that's why we're starting with that primer. Um,
I have a
What,
question,
yeah, go ahead.
Jennifer. I guess that's something I've been getting a little bit confused about lately. Like where you technically, like I know you start with assess needs in the spiff, but as I was looking at SAMHSA's website when they were talking about the spiff, they said the spiff is dynamic and iterative, and folks might be in multiple of these different steps at the same time, or like I'm trying to remember. I think that maybe they said sometimes you're going to start at different steps. Um, how does that like pan out?
So I have an example, the story. So last weekend, my church did an MLK Day of Service, and I made a Amazon wish list, and people in the church bought things, and then we packaged care packages for um, some of the neighboring community. And after it was all said and done, someone said to me, "Well, can you give me a list of everyone who donated?" I said, "Well, there were packing slips, but I just threw those away because I didn't think we need them. But if we had thought about evaluation first, we would have saved those. But we didn't think about evaluation until the very end. So we didn't have the things we needed to evaluate." So sometimes you have to think about other spaces when you're in a particular place. Um, so you might have somebody thinking, well, that's what I was joking with the other woman that was leading it because she used to do evaluation. She's now retired, and she goes, "Oh, stupid evaluation. I forget about that." And I said, "Well, now that we know that, next time we will start off with what do we want to evaluate so that we know how to assess and how to maintain things so that at the end we can evaluate it." Does that explain a little bit?
Yeah, I think it does. So it's like it's a circular process, but also sometimes like you might be thinking about these different steps at different points in time, like even thinking about evaluation when you're in assessment.
Yeah. And we're going to look at something here, actually, the next slide when we move down, but you might have a subgroup that's working on assessment and then a subgroup that's working on capacity at the same time. You're probably not going to have someone also working on implementation because until you know what needs to happen and what you've got, you can't do the implementation. Like, um, so for that event at my church, we were buying it was personal care items, so like deodorant and shampoo and body wash and um those kinds of things. I had to get all of it before I knew how many packets we could make because it was, we were just relying on people buying things. So I had to have my capacity done before I could plan and implement. Let's go through the like a little more specific on assessment, and maybe that'll help too. So when we assess, you collect your data, you try to figure out what is the problem, what's your resources around, and the readiness. What does readiness mean?
How receptive a population would be to whatever you're trying to build capacity in.
Right, right. So, um, another example from that same exact thing. So last year was our first year doing this event. And we thought we might have like 10, 12 people come. So we had stuff to make 10 blankets and stuff to put together 20 buckets. We ended up, so that was, we thought readiness would be kind of not low, but, low to moderate. Readiness apparently was much higher because last year we had 40 people come. This year we had 70. Um, we didn't assess readiness last year, so they got everything done within like 15 minutes. And we're sitting around going, what else can we do? So readiness is important because if you are working with a community and they're not ready to deal with it, and you're up here already talking about things we're going to do, you got a major disconnect. And then it's all about whatever geographic area you set. So I've always had people say, well, I don't really do community work, so I don't use the spiff. The spiff can be used and you can assess your classroom. Let's say you go in and do life skills in Miss Smith's third period health class. You can assess how ready is that classroom to handle it? What kind of things do I need to deal with in that classroom? What are my resources within that classroom? What are some of the needs and gaps? So don't get caught up too much on the like community, because community can be so many different things. So, as you know, they love to talk about lists. So, we do have a list of things that you can do in assessment. Those are define and describe the community. So, again, community can be a lot of different things. Collect your needs and the resource data. So, whatever it is that you need, or, um, you know, what kind of data is going to tell you what the problem is. Conduct that problem analysis for each substance. And remember, this is all very substance use focused. So you can extrapolate, conduct a problem analysis for each mental health issue, whatever. Create a logic model for each substance. Now, you and I know that we only have 24 hours in a day. I love when they say create a logic model for each substance. Um, Typically, you figure out what your main substance is and then you create a logic model. And then as we go through this, see number 5 here says update community assessment as needed. Because as you go through this, so as we went through last year's and saw how many people came, we changed it up and did things a little differently. We even had more people this year. So next year, we're going to have to go through and assess it again and say, okay, we need something that's going to give people time to do things. So again, don't memorize this list, but just understand the kinds of things that you need to do during assess needs or assessment. So I've seen it listed as assessment or assess needs, the same thing. So again, a question from the test might be, which stage of the spiff would you conduct a problem analysis for your substance? That'll be assessment. But if you think it out, well, where am I going to create a problem analysis? When you're analyzing something, you're assessing it, right? You're not doing anything, so you're not implementing, you're not planning. I could see where you might go, is it evaluate or assessment? But if we're conducting that problem analysis, it's going to be analyze. Don?
I'm sorry, that was an accident.
That's okay. That's all right. It's all right. All right. So what kind of speaks to August's question earlier is doing work groups. This is one of the pages that they specifically call out. It's page 9 of this community assessment primer. But the way I've seen this is they might use that term community assessment work group in a question. You just have to kind of understand what it is. So think of your coalition, and within the coalition, there are different work groups. So you might have one work group that likes to analyze and work on data. Who might be somebody that you would put in that work group? So think about a coalition. Who might be some good people for that work group?
Would I'm thinking of like maybe like research groups from like a local university.
Yeah, that'd be great.
Probably your public health people because they have access to a lot of data.
Yep, absolutely. And it's okay to read ahead on the slide. Um, yeah, so anybody who might have a lot of data. College, if you've got a big college in your area, that is a fabulous place. I don't want to say that we're just using students for free labor, but um, if you're able to give them a give them a title that they can put on their resume, um, you know, data expert for the XYZ coalition or something. Sometimes that's enough. But you really could have anybody on it. But you want to think about those people who are going to have access to data first. I was working up in Stark County on a project, and we were talking a lot about um, recidivism in the court system. And we had a judge, and we're like, we need you on this because he had access to get to a lot of the court records. Um, so again, just understand that work group, you might have a capacity work group. Of course, we're talking assessment right now, but you might have a capacity work group that is kind of making connections with places and people in the community. You could have a planning work group. So if you see that term, we're just talking about like a subcommittee. Now, you and I both know, all know, that if our community is the school, you might say that one of your work groups is the guidance counselor at the school. It's not going to be a whole committee, but it might be okay, this is the one person that I know to go to for the assessment piece, or this is the one person I need to go to for the planning piece. Planning might be like, the school secretary who knows what classes are going on and when this bell schedule is and all that. Questions about community assessment work groups or just work groups in general? All right, so this tree is specifically called out. It's from page 41. We're going to go through the different parts of this tree because this tree has all the pieces on it that will get us to that first part of how do we figure out what we're going to do here. Um, so I've kind of broken it down, but I just wanted to show you all together. And now we're going to look at the different pieces parts. Yeah, August says, you always want like a work group when you're thinking about community assessment. I can't imagine doing a full community assessment by myself. Um, it would take forever. You would be working 70, 80 hours a week. So yes, absolutely a work group would be best for doing anything like that. If you've ever done like the tri-ethnic community assessment or any of those community assessments, they're a lot of work. They're great and they end up with great data, but it's a lot of work. So yes, a work group would always be best. All right, so let's look at what's above the ground on this tree. We've got in the tree, we've got some data that maybe we've pulled together in general. So if you look at the data, we've got like poor school performance. So we've got maybe a school that has had a lot of alcohol-related discipline cases. And maybe we're also looking in, ooh, there's a lot of DUI injuries. And a good chunk of those, about a fifth of those, are minors. Um, Maybe we see a lot of data that comes up about teen pregnancy and how it's related to alcohol use. And then maybe we also see a lot of data that comes up about youth violence. So all those tree pieces, all those leaves have different pieces of data. And if you look at all of that data, you might kind of see a bit of a recurring factor of underage drinking. Now, You might have data that shows you 2 or 3 trunks, so to speak. That's where you kind of have to then think, what's the priority? And there is a way to look through how to prioritize, and we can talk about that later. But for this one, we're looking at all this data and we're seeing that it's underage drinking. So then we look a little bit closer and we see that 58% of 12th graders say that they've had alcohol in the last 30 days. Or 21% of 10th graders were binge drinkers. What's binge drinking? Anybody know that definition?
Continual drinking at one point of time.
But there's a specific number. So
Oh,
it's, yeah, 5 or more drinks within a 2-hour time period. Typically, they say that's
okay.
for men and 4 for women. So think about if you drink a 6-pack in the first half of the football game, that's binge drinking. And then maybe you've got 20%, 27% of 6th graders have already had alcohol. So you've got the big data that you're looking at the whole community. You've figured out that the trunk, or like the main issue, is underage drinking. And then you look a little bit further specifically for that, and you get this data. We're still all above the surface right now. We're just looking at what you can see in the community. So at that point, your problem statement might be underage drinking is a problem in X county as evidenced by, and then you might pick those data pieces. 58% of 12th graders reporting having had alcohol in the 30 days, in contrast to the national average of 16, state average of 30. Your problem statement could have been about 10th graders. Your problem statement could have been about 6th graders. It's kind of whatever the, well, you have, this is where you have to also think about capacity, because maybe you already have a group with the 12th graders. You're like, I want to focus on 12th graders. Or maybe you already have a group with the 6th graders, so you want to focus with 6th graders. There's really not a right or wrong. It all has to do with how those things will come together. So I personally just picked this one. When you're writing a problem statement, and this is going to create our logic model, when you're writing a problem statement, you usually want to give it some context. So in this one, I put in the national average and the state average. Because 58%, you might be like, well, yeah, most 12th graders drink. It's not a big deal. But then when you look at it in relation to the national and state averages, you'll see why it is a big deal. So just in what we could see in the tree, in the trunk, in the grass, we came up with what is the problem statement. So now let's look at the roots, because, well, before we get there, and I promise you, all of this is going to matter on the test. What is something you might do if you see this? What is something you might do to address that problem?
You would look at how are they accessing alcohol.
Okay. Can you need more information? You guys are thinking too far ahead.
Oh,
No,
Maybe,
that's good. That's good.
would you want to like do groups or do some
Maybe
focus
you could,
something
yeah,
on them?
maybe you could do some education groups. Um, we want to teach these kids. So if I were someone that wasn't thinking and going through the whole spiff, I might look at this and say, oh, clearly those 12th graders need education, right? Clearly. Well, you guys are all good, so you know that there's probably something else going on. That's where we look at the roots. And when we look at the root causes of all those 12th graders having alcohol, that's where we get a little bit more information. So maybe we notice that 1 in 5 merchants aren't carding. And those kids always know the stores that don't card. Or bars will accept a fake ID. Or older friends buy it for them. Availability, it's just easy to get. Or maybe parents are giving it to them. Parents are like, well, if you drink at home, it's at least, I can control it. Or maybe people just think, you know what? Kids will be kids. It's not a big deal. Just let them have fun. Again, going back to the belief supervised use will prevent DUIs. At least they're at home, so they can have a big party there. Or the belief that teen use is inevitable. How could you get some of this information here on the right-hand side? Like, how would we know any of this?
Maybe a survey?
You could do surveys, and this is where you need someone who's really good at writing surveys. Yeah, your needs assessment in the community, maybe focus groups. So sit down with parents and with teens and just ask some questions. Let's say we are picking this one. There would be very specific interventions for this problem, root cause, different than others. Now, remember we said, oh yes, ask questions about parental perceptions. Yes. So that might be one way you could get this information. But remember when we were originally looking at this, we said one thing we might want to do is educate 12th graders. Well, when we look at these root causes, is there anything in there that says that they don't understand? No, they probably know that alcohol is not the safest thing for them. So educating the 12th graders, while might be good information and might be helpful, it's not getting at what the root cause is. Let's say we decided to attack this 1 in 5 merchants not carding. What might be an intervention that we might do or an activity that we might do to get to that, to address that?
Environmental changes, policy
Such
changes.
as policies.
Yeah.
Yeah. Maybe we do, some compliance checks and then either punish those that fail or support those that pass. Maybe we look at, let's go to believe supervised use will prevent DUIs. What are some activities that we might do to impact that?
Is that something we can like try to educate the parents?
Absolutely. Yeah. And this will come up on the test. They will give you, here's the root cause. What's something that will match with it? So if they say the root cause is that parents believe supervised use will prevent DUIs, and you look at all the possible answers, and one of them might be group education to 12th graders, that doesn't match with the root cause. While it might be a fabulous thing to do, it's not going to match with the root cause. Questions about that? Because this is one that's tripped up people.
Say that one more time, please, Jennifer.
Yeah. So when we looked back here at underage drinking for 12th graders, one option might be to educate the 12th graders. But if we really looked at these root causes more and we pick this root cause, educating the 12th graders is not going to get to the parental belief that supervised use will prevent DUIs. So when the test asks, your root cause is that parents believe supervised use will prevent DUIs, what would be a good intervention? You might have all four of the answers might be good interventions, just not matching with this root cause. So something that might match with this root cause would be parental education on why supervised alcohol use is not effective or not good for kids.
Are they ever going to give you multiple root causes in one question that would trip you up?
I've never seen an example like that. I mean, that would be pretty cruel. I could see something kind of flipping it, like providing parental education on supervised use would address which of the following root causes. And if you're having parental education, merchants carding is not going to be impacted by that. You would have to
And
look at those specifically. Yeah, Hannah.
okay. And this might be, I'm just kind of like thinking as I'm
Yeah.
talking, but and this might just be like curiosity more than test prep, but since I'm in the social emotional world and not in the like drug and alcohol prevention, my mind is always just going towards how is this related to social emotional? Is it ever going to be a little bit more kind of fluffy, like, oh, a root cause is that like the peer pressure, or a root cause is kind of like how do I fit in, or sense of self, or is it always going to be kind of these more concrete things like parental things and policy things?
So the root causes are things that you can test and check. So I could see where it might say that, so our problem statement might be 58% of 12th graders report feelings of loneliness. Okay. Compared to whatever the national and state average is. And then your root causes, maybe one of the root causes might be that they lack social skills. Maybe another root cause might be that there's a lot of bullying in the community. Maybe another root cause is that the community is very spread out and it's hard to connect. So if you think of just those three root causes, they would have different activities that you would do to address them. So if it's that the kids don't really have social skills, you might do a social skills group. If it's kids are lonely because there's a lot of bullying going on, maybe we want to talk about bullying and bystander. If it's because the community is very spread out and it's hard for people to connect, maybe it's, maybe you want to do a community activity where everyone can come together. Does that help put it into your field?
Yes, thank you.
Okay. So we've decided that this is the one we're going to address. We could have picked any of these. Sometimes, and there's a whole way to figure out which one you're going to pick. Sometimes we know that we've got the capacity to do this. Maybe if you're looking at the merchants not carding, and you might say, you know what, police in our area have no way to add on one more thing to their plate. So these first two, we're not going to be able to deal with. Or it might be, you know what, we already have a huge parent group that we work with. So maybe, it's going to be easiest to do this. So you want to look at the changeability and how easy it is for you to do the work. So we've picked this one. So we're starting up our logic model. So we've got our problem statement. Underage drinking is a problem in X County as evidenced by 58% of 12th graders. Why? Because 84% of that county's parents believe that supervised use of alcohol by teens will prevent DUIs. There's one more question then that we need to kind of look at. Why is that happening here? Why is it that parents here in this community believe that supervised use is okay? There's lots of different reasons. Um, sometimes it's because that's the way it's always been. Sometimes it's because we had kids at a party out in a field one time and um, someone got really sick and ended up in the hospital. So now we all want to supervise. Um, or it may just be that parents lack the knowledge to make healthy decisions about their teens and alcohol use. And for a lot of times, that's just the but why here. So now looking at this, so we've gotten real deep into this. Looking at the but why here, what would be your activity you would do to try to make a change? What would
You could
address? Go ahead.
you could educate the parents about how to make healthy decisions with their teens about
Yeah,
alcohol use.
yeah. So do you see how by digging down into those root causes, we can be more specific on our activity? If we just looked at the problem statement and educated the 12th graders, sure, that'd be great. But it wouldn't get to what the root cause was, that parents just don't even know how to talk to their kids or make healthy decisions with their kids about alcohol. Yes, ma'am.
So I know like with the different root causes, like we didn't go forward with all of them, like we're just focusing on the one right
Mm-hmm.
now. Um, and I know like basically in our coalition work so far, it seems like when we've been making logic models, like we might have like 8 of these different root causes, and we have been focusing on all 8 of them and trying to address them. And
Uh-huh.
yeah, capacity has been very limited. And so when you're talking about focusing on our changeability magnitude, like maybe that's something that our coalition needs to focus on because we haven't had capacity to
Mm-hmm.
do all 8. It's different if we do, but we haven't. Like the
Right.
one strategic plan we haven't really made a lot of progress in. And so maybe we need to kind of narrow this down to like what can be changed. I know policy is always one of those things that's kind of hard to change, especially like given my specific role being at a government entity.
Mm-hmm.
Um, anytime you're trying to influence policy. So
Yeah.
maybe like focusing on what we can actually change.
Yes. Yes. And that's when we were talking about being in several of the different places at once. You're kind of looking at what can we actually do? Um, and there's a lot of coalitions that get caught up in that. I want to just fix everything. If I could change the world. Um, but really digging down into what that main root is what's going to, you're going to see a change quickly or quicker than if you're trying to put, it's like the, for my visual learners, imagine a wall with water behind it and you put your finger in one hole and you're going to do a difference. But if you have 10 holes that you're trying to fill up, uh, you're going to be running around like a chicken with their head cut off and not doing well on any of it. Um, it's
Jennifer,
frustrating. Yeah, go ahead.
what if the parents as a whole are not ready to hear this message? Then what happens?
Interesting. Yeah. So, um, if you do kind of a readiness survey on the parents and they're like, they go back to um, teen use is just inevitable, where everyone's just going to use, don't worry about it. Um, you might put like pinky finger on this one and then maybe pick another one. But that's why there's so much that goes on this in this assessment before we even get to the planning and implementation. And back in the old days of prevention, they would give you a grant and expect you to put implementation on day one. And that's why things weren't working as well. Because we were trying to implement something and we didn't even know if that's what the problem was. So, yes, you're absolutely right. So, when you look at this tree, you'll see how it's the data that comes in, you see what the main problem is, you see more data about it, and then the root causes. So again, remember, you're not going to have to fill out a picture of this tree, but just kind of understanding the flow and how that would work. Any other questions on this? This is good stuff. All right, this list of terms is the bane of my existence. They're going to use some of these other terms, just understand that they mean the same things. They might say something like you've gathered information, which means you've gathered data. You know, you've got an indicator that says XYZ, that's data. When we're looking at what are the root causes, those are some of those risk and protective factors. So think back to our root that we just did. The risk factor was that parents gave their kids alcohol supervised. They might say contributing factor. I've never seen casual factor or causal factor, not casual, causal factor, but I mean, they put it there. This objective, this always frustrates me because we know that these are really different things. Outcome, goal, aim, and target. But there might be a possibility that they might use some of those the same way. And then your strategy is just basically what you do. So that might be your program, your activity, your action, your initiative, whatever that might be. All right, so just look that over. Just know that if you see one of these in a question, this is basically what it means. So let's move on to capacity. Capacity is where you mobilize and build capacity within a geographic area to address needs. Again, remember, this might be your classroom. You might go into the classroom and see that. So I did Incredible Years, which is a program for little ones. And the capacity was that a lot of the classrooms didn't have, we had DVDs to play during it. Most of the schools didn't have DVDs anymore. So a capacity piece was we didn't have that. In a community, you might need to say, you know what, there's nothing for the kids to do here. So how are we going to handle that? Or there is something for kids to do, but kids can't get there because there's no transportation. It's basically just looking at what do you have in the community? Part of that is building that coalition membership. So a coalition of 3 is not going to get as much done as a coalition of 50. Develop that structure, because if you don't have who's going to do what, it's going to be much more difficult. We usually want to have leadership. So somebody who's going to kind of steer the ship. And then what are we doing as far as getting more information out to the coalition members, the community members, so that we have knowledge is a capacity too. So we've talked about this a couple times. I'm just throwing this back in there again because they talk about it in this primer, is the people on coalition. Again, I would have to really think if I don't memorize, but just know that there needs to be people from lots of different places when you're building your coalition membership. There's a difference, but oh, go ahead.
Quick question,
Yeah.
Jennifer. So, I know that there are the 12 different sectors, and not every coalition needs to have all 12 sectors, but how do you identify what sectors need to be at the table for your specific coalition?
So your community will dictate that. When you do your assessment, you'll figure that out. So, like religious and fraternal organizations, you may live in a community that does not have a lot of churches. Church is not a big thing for a lot of people. So, you could have someone, but it wouldn't be as important as maybe you have a huge hospital. And so, you definitely want to have healthcare workers. Or I think I mentioned last week or the week before that, the Lebanon YMCA in Warren County is the largest in the country. If you don't have somebody from the YMCA on your coalition, there's a problem. So it's not going to be a specific, this is who you need to have. It's looking at who your community is.
Would it also be based off like the problem that your coalition works to address too? Because like for our drug-free Stark County, currently there isn't any youth involved in the
Mm.
coalition, and as like one of our objectives is to help reduce the substance misuse in youth, I'm like, I think they should be at the table. And
Yeah.
we've been meeting with them separately, like historically, like in separate
Mhm.
meetings, but not involving them in the coalition. I'm like, well, why aren't they here? They should be here because they know the ways that youth are vaping and using marijuana better than any of us adults do.
And they know what they'll listen to better than we do.
Yeah.
Yes. Yeah, you're absolutely right. And that's another way that capacity can be kind of worked on multiple ways. So maybe at first you say, maybe we don't need youth, but then when you come up with the problem of youth vaping, oh, yeah, we need to have youth. So you then kind of bring them in. You can bring people, it's a very dynamic thing. You can bring people in at any time. The other thing I've seen people do when youth are difficult to get there because maybe you meet during the day, um, is having a youth coalition that reports to and gets information from the full coalition. But yeah, the goal or the dream is to have them at every coalition meeting as a regular member. Which I brought up that term member.
Jennifer,
Yeah, go ahead.
that I've done about right too with that. I do I do a hybrid for coalition, so
Mhm.
I use them like if it's their lunch hour, something, do a Zoom. So then
Yeah.
they're on my Zoom as well.
Yeah, absolutely. It's about being creative and figuring out what's going to work. Yeah. I've seen people who have the meetings at the school because then you've got a free space and then the kids can come out of class and go to the meetings. Um, when you look at the coalition, you've got members who are all those people from the different areas. Then you've got staff. Staff are usually the people who don't necessarily lead it, but provide all of those support roles, like setting up where we're doing the meetings, taking the minutes, kind of that business stuff. Although it often then slides back to the staff doing everything, which it shouldn't be, but it does happen. Um, this is another page, 35 to 36, is a page where they say that there is a question from here. So, one of the things we need to do is identify training opportunities. Let's say you've got a coalition, you've come together, you realize that youth vaping is your issue, but a lot of people in the community, particularly the adults, have no clue what vaping is. Maybe we need to have some education on vaping. Um, so when you look at what those training needs are, you can look at internally, how smoothly is our coalition functioning internally? Do you need to have like how do we run a meeting? I'll just put these up here. Do we need to have, a a training on what's a work group. So those kind of things on just how a coalition works, but then also connecting with the community. So this is where you might, there's so many community members. I'll tell people just Google your county and coalition. And they're like, oh my gosh, 50 different coalitions showed up. Like, yeah, they don't do a good job of advertising who they are. So, does your coalition have strategies in place just to let people know you're there? Have you figured out how to let the community know about things that you've accomplished? So just understanding that identifying training opportunities can be internally, externally for the community, can be a lot of different things. So we're going to watch a relatively short video. This is a video from a community here in Ohio. This was created by Kadka. And she's going to talk about the 7 strategies. We'll go through each one afterwards, but I just want you to kind of look at the 7 strategies and how they implemented them. So if you remember, the 7 strategies are things like provide information, enhance skills, provide support. Again, don't worry about memorizing. Change consequences, change physical design, and modify or change policies. So let's see how they did this in this community. I want to share computer sound. All right.
Southern Ohio's Scioto County became the epicenter of a nation's growing opioid crisis in the early 2000s. Scioto County attained the highest opioid prescription rate in the state. More than 9.5 million painkiller doses were dispensed in 2010, or more than 120 pills per citizen. The Ohio Department of Public Health brought together Scioto County officials, health departments, and other sector representatives affected by the opioid epidemic to develop a solution for this problem. 2 county health departments encouraged partnerships among local stakeholders, leading to the formation of a community coalition focused on both curtailing the current crisis and preventing youth initiation into non-medical opioid use. The newly formed Scioto County Drug Action Team Alliance participated in CADCA's National Coalition Academy training, where coalition leaders learned about local data collection, collaborative planning, and the development of comprehensive strategies to address substance misuse. Framed by the 7 strategies for community change, the coalition's activities targeted individuals as well as the whole community.
In our county, we can actually see live how many people have presented to the emergency department on a drug-related issue, and that helps us to identify, if we're having a spike in overdoses and if we're seeing improvements and things like that. We recruited within our school systems a person in each school system that would be that youth-led prevention leader in that school system. We really expanded access to naloxone, and I feel pretty good about that because naloxone is really just sort of a household word, very, very normal in our county, and people aren't afraid to use it. We began to expand our addiction treatment facilities. We definitely ramped up access to medication-assisted treatment. We got new providers. We've done trainings with new providers so that we could expand that workforce. And we also began to really expand our prevention. We were also able to get it to the law changed to where you didn't have to be a physician to hand that naloxone to someone. Now anyone can do that as long as you're trained. So that helped a lot. It wasn't necessarily feasible to expect a doctor to go with you every place to these outreach events. So we have that change now. We were actually the first county in the nation to declare a public health emergency over prescription opioids. And at the time, that seemed a little odd, certainly based on the phone calls I got from all over the Associated Press and everybody calling, but now here we are 8 years later, and we have a national public health emergency related to prescription opioids. So we were just really kind of the canaries in the coal mine in Appalachia in terms of the devastating effects of these drugs. Well, the thing that I learned at the National Academy, and the strategies that we learned and the tools that we made there really kind of helped me to hone in on specific data and think very strategically about how to address that problem. Looking at root causes in the community, looking at the big picture. We've had reductions in past 30-day use of alcohol, marijuana, tobacco, and the largest decrease we had was in the non-medical use of prescription drugs. We also had reductions across the board in all of the other categories of drugs. And so, we feel like we really did a good job with our youth. Our adolescent prescription, non-medical use of prescription drug rates are actually below the national average. Our prescription drug-related fatalities have declined. We have also seen our hepatitis C rates decline, and we comprehensively address all of those things through other avenues. In coalitions, you're not dealing with just this person or just this set of people. You're dealing with the environment, the entire environment where these people live and how they interact.
All right, so let's look through those real quickly. I'm not going to harp on it too much, but I want you to kind of see how these 7 strategies were implemented with their coalition. So first we have provide information. That's where they got the data and then kind of let people know about the data. Just figuring out data to begin with. Then they went into the enhancing skills. That's where they did the community-wide initiative Start Talking to get parents and teens talking about things. They did the youth-led initiative in the schools, youth-led prevention training, drug-free workplace training. So they were trying to enhance the skills of the people in their community. Then they looked at this strategy number 3, provide support. That's where they did the first community-based naloxone education and distribution program. And you might be saying, well, isn't that skills? It's a little bit of both, because you're teaching people how to use naloxone, but you're also providing that as a support to the community. The education campaign on overdose prevention, recognition, and response. Again, it's a little bit of strategy 2 and 3 together, but it's supporting people because it's letting people know here's what to do. And then also the training the first responders, because they would be a support to the whole community. Strategy 4 would be enhancing access or reducing barriers. So they expanded addiction treatment facilities so that enhancing your access, more people could get there if they needed to. They got new providers. So, if you only got 5 people, you're only going to be able to serve so many, but they got more so that they could serve more people. And then amplified or enhancing the access to their prevention efforts. The 5th strategy is changing consequences. So this is where they had some policy changes, allowed for regular citizens in the community to possess and administer naloxone. So it used to be that, you couldn't just walk around with it, but they changed that consequence. The consequence now is that there is no consequence if you are walking around with naloxone. That has saved lives, period. So we know that, changing that consequence can make a difference. The physical design, this is a bit of a stretch, but that they became a high intensity drug trafficking area, that they got that designation, which while it's not really physical design, it's metaphorical design. It changes the concept of that community, which would allow them to do more and have more opportunities. And then the modifier change policies. They went to CADCA, which is coming up soon. Is anybody going to CADCA this year? Last I went the week before COVID hit the world. So it's been 6 years since I've been. So they learned training, learned how to use their data to then figure out what kind of drug monitoring system they want to modify and change. And yeah, where's the mid-year this year? August. Changes every year.
I don't remember. I'm not sure.
I don't either.
I thought it was in DC, but I could be wrong.
Well, that's the one coming up soon is always the one in the beginning of February is always in DC. Mid-year is like sometimes it's been in Florida, it's been in Chicago, it's been in Texas. So I don't know where it is this year.
I'll look it up.
Yeah, just an interesting thing. So that's our 7 strategies for community change. Because they love other steps. Did you find it?
Not yet. Every time I go look this up, it shows me like the trainings from 2025. I'm like,
of course, yeah. They've got the 7 steps of program planning. I wouldn't stress on this too much. Just know that, when you're in capacity, you're also thinking about planning. That's why they overlap a little bit. And you have to start thinking about what are some of the things that we need to do in the school. All right. Thinking assessment. We need to think about data. And this is a different book. Don't worry about that page number. But archival indicators. Anybody ever heard that term before? It's a funky one. So think archives. So what are archival indicators? Think of archives. Archives are basically like the library of the community. It's any data point that was collected prior to when you're beginning. So what are some things that might be archival data?
An article from a newspaper reporting a problem.
Exactly. Back when newspapers were relevant, right? Okay, Florida. Very cool. What else might be an archival indicator?
You look at something like the OES and you have years in the past versus the current data.
Yeah. So we look at student drug use surveys from 1995 to 2015. That would be archival data. You might look at hospital records.
What about juvenile records?
Yeah. So how many youth were arrested for drug use during this time period, this time period? Yeah. So
coroner's office, like EMR records.
Yeah, exactly. So that's where we can get it. Some of the types of things we might be looking at would be things like availability. So like, did the kids, that was one of the things that when COVID hit, the availability of vaping plummeted, right? So yeah, rates of vaping went down during COVID, but was it because we did some great work or was it because availability was down? Of course we did great work. That's definitely what it was. You might look at community laws and norms. So us old people remember when you could be 18 to smoke or to drink. But then laws have changed, and what has changed with that? Transitions or mobility. We know COVID was a huge transition and the community changed a lot of things. Whether or not people are connected with their community. Sometimes, somebody will do something to increase that connection and it might change other things. I don't want to go through every single one of these, but you can look at this slide and see some of the things that you might think about with archival data. Now, let me ask you a question. Is archival data, do you think that would be easy or hard to get? For the most part.
I think some of this can be hard to get because some of this might be within specific agencies in the community or even like nonprofits. And a lot of the times, if they're going to be sharing their internal data publicly, they have to have a reason why they're doing it. And a lot of times, there can be multiple different steps implicated in doing that, even if they are interested in sharing their data. I know that's something that we have run into.
So, how could you get around that? How could you address that problem?
Engaging them and seeing what would motivate them is definitely important. We've talked about inviting these folks to the coalition meetings. And so if they are a coalition member, they're going to have more buy-in.
Yep.
And insofar as needing permission from their agency, they'll probably be more likely to take some of the initiative to be able to do that sharing, or if they're the ones doing the sharing in the meeting versus it's not someone within their agency, then you might be able to circumvent some of those issues that comes with sharing internal data externally.
Yes, very good. So keep all that in mind. We're going to go over some practice questions now. So we're going to start off with a needs assessment that uses information collected from interviews, focus groups, and/or observations involving document reviews to produce a descriptive report. So just look at this question. What are some things you notice in this question that kind of give you some, oh, this is what it's about?
The focus groups, observation,
Okay.
interviews,
Okay.
and descriptive.
Okay. What do those tell you?
That it's a lot of qualitative data.
Okay.
Yeah, like the data.
So it's qualitative data. Why? What is qualitative data?
It's not just numbers, it's like opinions or people giving you like answers to open-ended questions.
Okay.
Descriptive information.
Yeah, descriptive. That was a good call out of that. So looking at this, we know that a lot of this is describing qualitative data. So let's see what our possible answers are. The answers might be qualitative data, outcome data, quantitative data, or indicator data. So let's go back and just make sure that we're not jumping the gun. I shouldn't use that term anymore. A needs assessment that uses information collected from interviews, focus groups, and/or observations involving document reviews to produce a descriptive report. So now that we've seen the answers, we've gone back again. Are you guys still stuck on A? Just say yes. Yes, we're still stuck on A. Yes. Because it doesn't talk about any kind of particular data. It doesn't say, after doing a activity or it's just very vague, but it's vague about qualitative stuff. Does that make sense? Yeah, I think descriptive report is the key. Yeah. Yeah, if this said uses information collected from surveys, reports to create a numeric report, then it might be quantitative. Yeah. Yeah, qualitative is quality of words, quantitative is quantity of numbers. All right, let's look at the next one. The most important feature in creating a logic model is. Now, what is a logic model? If you had to give just a one sentence to someone.
Model of how you're going to address an identified problem.
Okay. Don, did you want to say something different or?
I was gonna say identifying goals and outcomes that you would want to get out of.
Yeah. It's a picture of how you're going to address what you're going to do and how you're going to get your outcomes. So we kind of keep that in the side of our head while we look at the answers. Most important feature of creating a logic model is they try out multiple strategies. They enhance community involvement. They help you determine staffing patterns. They connect outcomes and your goals. Now, this is one of those that could looking at a logic model help you figure out how many staff you need because it tells you how many strategies you're going to do? Yes. Could a logic model try out different strategies, like put different strategies in it? Yes. But is that the most important feature? You guys talked about the most important feature was those outcomes and goals and connecting how you're going to do things. So while these may be part of it, it's not the most important. And that's one of the things that they like to use things like most. Questions on that one? All right. Archival data is. So we just talked about what archival data is, right? It's information that's had before that we get together. So let's look at our possible answers and see which one might be the best answer. Information from a large number of individuals. Is archival data always information from a large number of individuals? Not necessarily.
Yeah.
It might be notes from a focus group they had 5 years ago of 10 people. That could be archival data. So, okay, that might not be. Is it agency compiled information? Is it information that your agency gathers and puts together? Let's put that one on the back burner for a second. Is it hard to find?
Sometimes you're not always.
That's exactly the answer I wanted. Yeah, sometimes it might be, but it's not something that you would say all archival data is hard to find. Is it collected from surveys?
I mean, it could be.
But is all of it?
No, but not
No.
all.
Okay. So, and this is a funky question, but the answer is B. Because when we're looking at archival data, it's data that we have gathered together. I wish it said just compiled information because it might not be an agency, it may be a coalition, but it's just information that you've gathered together.
So do you think that word would be agency? Would that be something we would look for versus business,
No,
company, whatever?
compiled together. It's compiled together is what I would
Okay.
look. Yeah.
Got you. Okay.
Um, yeah. And look at them and say, is it always these other ones? It's not always these other ones. It might be some of it, but it's not always. Um, Amy, will you check your private message? I want to make sure that that's the right address. So just let me know. All right. So next week. So between now and next week, you got a lot of things to look over. We got snow days, you know, you'll have nothing left to do. I'm joking, I know. But read the planning, implementation, and evaluation primers. And then if you still have time, read chapters 5 and 6 in that uh, exam study guide. I will also send you another Kahoot to do. We already know that Amy is competitive, so somebody knock her down. I am too. It's okay. Um, and I will send you the links to those two Amazon lists, to Cram, um, anything else that you might need. All right. I know I've met with a couple people working on your grids. I am, you know, open and available to help with that. I'll send you my calendar invite again. I need to make sure I've got it through the end of March. Can you believe how far we're already into the year? It's almost the end of January. Yes, Miss Jessica.
Hi, Jennifer. A quick question. So as I make, prepare all of my certificates for when we, apply for the next level and, after taking the exam, is that something that you are able to review? Like if we send you like, hey, this is how I have it set up to cover this domain and all the hours I have. I just want to ensure that as far as education hours, I'm on track to have what I need.
Here's what I would like to do. And this may sound crazy, but this is the honest truth. I would like you to put in an email all your certificates and send them to me. I will put them on the grid. I will see if there's any holes. And then if you want, maybe like a week or a week and a half after that, set up a time to meet and we can look it over and see if there's anything amiss, or any holes that we see and talk about how you're going to fill those.
Okay, I really appreciate that. Thank you.
Yeah. I I I am kind of a dork. I really like doing the grids. Um, and it's
And by
for me,
grids,
it's
do you mean that document where what I've been doing is I've been going domain by domain and I've downloaded all the certificates I believe fit in that domain. And then it's that document, I'm sure I got from the website where you put in the title and the credit, like the amount of hours. Is that the
yep,
grid you're talking about?
yes. Yeah.
Okay, well, yeah, I
It's
guess I can send you my version of it and maybe you can just cross-reference it with, you can maybe see where I'm misplacing or
yeah,
correctly placing, hopefully.
yeah. If you haven't started your grid yet, and this is for anybody else, you don't have to. Just send it to me. I'll put it in here. Um, if you've already started, that's fine too. Um, but yeah, this is when we talk about the grid because you have to be approved to take the exam before you can take the exam.
Well,
Oh,
I appreciate that. Thank you.
yes, Ashley, I was trying to open it on my phone and then I found on my computer I can open it. So yeah, we were going down to see Hell's Kitchen and I was like sitting in the car with nothing to do and I kept trying to open it on my phone and it wouldn't open. So, but yeah, I really enjoy putting those together. So don't feel bad. That's what OCAM is here for. All right. Well, if there's anything else that you guys need, reach out. Don, I think we're meeting sometime next week. Um, I do enjoy it. I am a dork. I know.
Yes, ma'am, we are.
Yep. All
It's
right.
countdown time for me.
Yes. All right. I will see you guys next week if nothing else. If anybody needs anything, you can stay on. Otherwise, I will see you next week.